Good afternoon. My name is Shelby Klein, and I will be speaking about advocation for mental health treatment. It is important to consider alternative paths throughout this speech, and it shouldn't take a famous person to say it's okay in order to address mental health. Approximately 3 years ago, I was faced with the shock of my life. I was in a position where I attempted suicide by narcotics. Do you know anyone who has dealt with mental health, either recently, in the past, or is currently dealing with them right now? Approximately 19.1% of adults in the U.S. have dealt with mental health back in 2018. I credit this information to NAMI.org. This is the National Alliance of Mental Health Institutions. I can speak from personal experience that mental health is just like any other physical disease. It should be treated with the utmost respect because it can be extremely severe without executing a proper plan of action. So to begin the speech, I'm going to let you know that the 3 parts include when it started, what happened, what diagnosis were given and how it was treated, and then how I manage it today. So when did it start and what happened? It all began with small triggers when I was in about 2nd grade. I would throw tantrums, I would get angry, and I would have outbursts that were out of control. These were due to anxiety throughout the day when I lacked organization, when I had repetitive behaviors or compulsions that were a result of obsessive thoughts. This also coincided with when my mother was diagnosed with bipolar disorder. I remember many of these compulsions and obsessions even to this day. When I was first hospitalized, I was 17 years old. I was a junior, just about to be a senior, in the summer of 2013. I had many big decisions coming up ahead of me. I had to decide who I was going to swim for in college and when I was going to graduate and go to college, whether it was going to be in the summer or if it was going to be in the fall. I would have severe anxiety attacks and compulsive behaviors due to obsessions with numbers, cleanliness, and alignment. This hospitalization was in the summer of 2013 when I was only 17 years old. I spent about 10 days on a pediatric psychiatry unit where they decided to monitor my behavior and obsessions and start me on some medication. Some of the triggers that coincided with this hospitalization include stress from a recent shoulder surgery, lack of change in my physical and mental routine. Since I wasn't going to swim practice every day and I was now in the hospital 24 hours a day, it was very difficult for me to make this adjustment properly. Fast forward to 2016. I had been in college at the University of Kentucky 2 years prior to this incident. I had not very good luck as I had more shoulder surgery ahead of me. I had my surgery but was not able to recover as I had hoped. So I decided to go to FGCU in 2015. I was accepted and moved into South Lake Village that year. However, in the summer of 2016, I was still at FGCU. I was living in North Lake Village, Building P at the time, and I was struggling with some severe triggers. I had just lost 2 of my best friends in a very stupid argument about 3 to 4 months prior to this event. I had 2 more shoulder surgeries that had just taken place, and that surmounted to supreme stress. This caused uncontrollable, obsessive thoughts as well as compulsions. When I actually attempted the suicide, it was in July of 2016. I had taken multiple oxycodone with a bottle of alcohol by my side. I got these pills to take when I had finished my surgery to help, reside the pain. But I couldn't stay awake and I called for help. One of my sisters at the time from Alpha Chi Omega called 911 and the paramedics came to take me to the hospital. Although I barely remember anything at all, what I do remember is I could not reach my parents and I was taken to a place where I had no idea what was going to happen. Ultimately, my parents were reached. I was able to speak with my grandmother and talk with my parents about what to do next. I don't remember all of this, but this is what I was told happened. I was then admitted again to a psychiatric unit. This time it was the adult unit in Fort Myers, Florida. So what diagnosis was given during these 2 hospitalizations and how was it treated? So in the time between 2013 and 2016, I was given the diagnosis of OCD, bipolar disorder 2, and ADHD. OCD because my thoughts were obsessive and they caused dangerous compulsions when repeated multiple times a day. Bipolar 2 disorder because my mania manifested in the form of anger and irritability and sometimes compulsive activities. And my depression resulted in many days in the bed, crying and ignoring everyone and feeling hopeless. And ADHD because I could not sit still for the life of me, even when I was depressed, and I could not focus in school. I was given medications as my first route of treatment. These medications were to help with all 3 disorders, and I noticed some changes after about 4 to 6 weeks. Positive changes. I also used cognitive behavioral therapy with my therapist for OCD and dialectical behavior therapy with my therapist for bipolar 2 disorder. I manage it today through those medications. They're antidepressants, mood stabilizers, and a stimulant. I meet with my therapist about twice a month, review and discuss the happenings and changes in my life. I also meet with my psychiatrist, where we manage my medication, discuss what's upcoming in my life, and determine what stage and cycle of the diagnosis I am currently in. It is important for me to stay on track with meds and therapy. It is important for me to monitor my behavior daily. Mental illness, as you can see, can be very severe. However, it can be treatable when taken seriously and approached appropriately.